have reviewed the physician's orders and I've gathered my supplies to insert an IV for my patients. Good morning, Mr. Smith. My name is Lacey. I'm a student nurse and I'm going to be inserting an IV for you today. Do you have any questions before we get started?
No.
No? Okay. Can I please verify your full name and date of birth?
John Smith, 718XX.
Perfect, John. And do you have any allergies that I should know about before we get started?
No.
No? Okay, great. All right, let me just get my supplies set up here. Just gonna put absorbent towel under your arm so you don't get your sheets wet. And let me just start by finding a good vein. Okay, that one looks good. Just going to start by priming my tubing.
So now that hand's not sterile. And then I'm going to test my suction on this ceiling. Works. Okay, perfect.
Okay, got all the air bubbles out. Set this back in here until we're ready for it.
Go and take a deep breath in.
Okay, I'm going to put some gloves on and then get my patient's skin prepped. Mr. Smith, do you know if you have any allergies to chlorhexidine?
No.
No? Okay. If my patient had an allergy to chlorhexidine, I would be using an alcohol swab instead, and I would be cleansing the area of insertion 2 to 3 inches around the area of insertion with a cotton swab or an alcohol swab. So since he's not allergic, we're going to use the chlorhexidine instead. Working in an upward motion 2 to 3 inches around the insertion site for 30 seconds and then letting it air dry. Okay, now that it's dry, I'm gonna reapply the tourniquet. Make sure that's still a good vein.
Sounds really good. Then I need to continue to press them.
And I'm gonna inspect my catheter and make sure that it's intact, and it is. Stabilize the vein and inject or insert the vein bevel up until I see a flash, which I do. Stabilize the needle and applying pressure to the vein as I remove the needle. All right, and then I'm going to aspirate for blood return. And then I'm going to insert 3 milliliters. We're watching the area of insertion for any swelling or pain that the patient's describing. Now I can remove the sleeving and lock the tubing.
No, you're just, I mean, I'm gonna keep it clean while I do all this. You're gonna clean and
Okay. And then last I'm going to label the injection site with a gauge of needle, which is a 22 gauge needle, that it was inserted on 9/11 into the inner aspect of the forearm at 14:30 p.m. And then documentation, I would indicate that I'd made no more than 2 attempts, and I would document the gauge of needle, 22 gauge, inserted in the inner aspect of the forearm, the left forearm, and that the patient tolerated it well.